Good morning, good afternoon, good evening, wherever you're at. Welcome to our Facebook Live about the third edition of our EAMC. That's the Epilepsy Assessment Management course. My name is Tolu Olaniyan, and I am the founder of Pretola Global Health and Consulting. Today, I've got a couple of people here that will be sharing with us about an important topic, Tuberous Sclerosis Complex. And I'm going to let them introduce themselves to us. So I'll start with Torie.
Hello. Well, I don't have tuberous sclerosis and I'm not from the organisation, but I am a fellow epilepsy ambassador person, I suppose. I do have an epilepsy rare type and I'm founder of Epilepsy Sparks.
Hi, I'm Ashley Pounders. I'm the Director of Medical Affairs at the TSC Alliance, and I am a nurse practitioner and have worked in TSC clinics in the United States.
Hi, I'm Katie Smith. I'm the Director of Government and Global Affairs at the TSC Alliance. So working with all of the TSC organizations around the world.
For all of our new members and people watching us newly today, so the EAMC, which is our Epilepsy Assessment and Management course, it's a international, a virtual course, international course for clinicians in low and middle income countries, that they can sit wherever they're at in their countries and learn from experts across the world. The idea is to build epilepsy experts and capacity building in these countries to support our peers in low middle income countries to be able to acquire skills needed to support people with epilepsy in their countries. So this year, in this next EAMC starting January to March 2022, we decided to switch it up a bit. We decided to go into to learn a bit more about TSC, that's Tuberous Sclerosis Complex. And knowing that it's one of the genetic causes of epilepsy, we wanted our participants to learn a bit more about it. And that's why we've partnered with TS Alliance on it. Torie?
Yes, so first question, I guess. Could you please tell us more about the Tuberous Sclerosis Alliance? First of all, the organisation, how it came about, and what you do, your role, etc.
Sure. So the TSC Alliance is an international recognized nonprofit that does everything it takes to improve the lives of those affected by TSC. We drive research, improve quality of care, access and advocate for all affected by the disease. And the collaboration amongst the individuals and families, along with partnerships and of other organizations, really fuels our work to ensure that navigating TSC community has the support and hope at every step of their journey. It was founded by 4 moms, and essentially they just got together and really were trying to find the resources and find that connection with others in the community that were experiencing the same type of hardships that they were. And it is just completely evolved into a very profound international support for all with this disease.
And that's so lovely. Could I just check, when you say all affected, do you mean individuals with the diagnosis alone, or do you mean families as well?
Yeah, so that's a great question. And the TS Alliance specifically, we are here for all a part affected by the journey, which would be the individual who has the diagnosis, as well as those, the caretakers, other family members, and, the resources to the local medical team even.
I like that it was actually founded by 4 moms, parents that decided to do something about it. That's cool, isn't it, Torie?
Yeah, well, it's actually really hard. It's lovely to know that, that there are parents / caregivers that are out there seeking information, credible information, and want to help provide it for other people. It's really nice.
Yeah. So the next question is, what is Tuberous Sclerosis Complex?
And why is it such a mouthful?
Yeah, why is it such a mouthful, isn't it? It's like tongue twisting. Tell us a little bit more about it.
Yes, it often gets mispronounced or termed as tuberculosis, right?
Yeah.
So tuberous sclerosis complex is a rare genetic disorder that can affect anybody across the lifespan. It is tuber, so kind of think of potato, and that's kind of what these lesions look like. So that's kind of where the name, originated from. And the reason why we call it that is because these tumors can grow really in any organ system. Most commonly, the brain, heart, eyes, kidneys, lungs, the skin. And so that's, really the hard part of this complex disease, is because it's so multifactorial. It's not just one specialty. It really crosses every area of human life.
Is it specific organs that the tumours attach themselves to, or can it be other sort of more, general pieces of flesh, if you know what I mean?
Yeah, I mean, it can really, because it's genetic, it can really form anywhere there's cell growth that can occur. It can really accumulate anywhere. So most commonly we know in the areas that I've mentioned, but it's not abnormal to find it in, other non-common areas that we don't necessarily talk about as much.
There are two sort of questions which link together now. So first of all, how can tuberous sclerosis complex, did I say it right? Yeah, I think that's right. Yeah, affects a person's behaviour. So how does it commonly affect a person day to day? I guess is sort of the question. Mood, behaviour, that sort of thing.
The tubers can most commonly, that we get concerned about in childhood is the epileptic component. And but you make up a really good point, is the psychiatric component of tuberous sclerosis, and that's coined as TAND, which stands for tuberous sclerosis associated neuropsychiatric disorders.
Oh wow.
And that is where a lot of families really struggle. It's really hard for the awareness aspect because it's so broad. And I mean, it affects everything from behavior to psychiatric, intellectual, academic, the memory recall. So you're thinking of the dual tasking, cognitive executive functioning, and then just the psychosocial aspect of it. We see a lot that, might have borderline IQ status. So they really kind of get overlooked, but really don't have that pragmatic skill set to really help, navigate their journey. And so it's very complex, even from just that one aspect of that manifestation. So that's really the main goal of, a lot of what we do is to spread the awareness that it's not just an organ system. It's so much more than that.
I kind of want to ask, what are the common features you could possibly see that could make a clinician or anyone to start to think of TSC?
So typically, we recognize it early in childhood by the onset of epilepsy. And, that kind of starts the process of doing the imaging, and then we see these, tubers. And then it kind of more of a sequela of diagnostic workup at that point. A lot of times we do genetic testing, and that can kind of then, spearhead the diagnosis, but not always. And so other key factors is really looking at the skin, these, the facial fibromas, the Sjögren's patches. Sometimes the presentation might simply just be from a kidney perspective. And so, that is another really concern later in life. And then another factor at birth is the cardiac rhabdomyomas. And a lot of times that's picked up on cardiac or ultrasound in pregnancy. And so we know that those are individuals that present at a higher risk of this disease, and we like to follow them after delivery.
These tumours, correct me if I'm wrong, they're more often than not cancerous. Is that correct? That they can be?
So these type of specific tumors are benign, meaning non-cancerous.
Yeah.
But there are some concerns that these individuals are at a higher risk of developing certain types of cancers. So they're like 2 to 3% higher risk of developing a renal cell carcinoma. And so it is really important to, have this awareness because we definitely don't want individuals diagnosed with an oncological diagnosis when the treatment plan and the interventions would be, drastically different. But we do actually see that happening.
I've heard of, and actually, because it was an article I read, I think in an Epilepsy Action publication about somebody with tuberous sclerosis, and they didn't, they found out that their mums and mum or dad carried the gene, so it wasn't de novo, instead it was inherited, but the parent didn't have any tumours at all. Is this just an example of how much the disease can vary?
Right, exactly. So, and that is not uncommon that, the offspring, right, of a parent who has TSC that didn't know about it, their child actually presented with epilepsy. So we then default by looking at the genetics of the parent, and they actually have it, and they are 50% likely to give it to their offspring, and so it is common to see that. So yeah, it just represents the wide variety of the phenotype, and we can't really predict that. So you might have a very mild phenotype, but your child has a very severe phenotype.
Thinking about lower middle income countries, now from experience of, we've done working with in people in Sierra Leone, back in my country, Nigeria, and working with organizations in other countries, Gambia, and all that. This actually supports, Torie, what we always say, that epilepsy seizures are it's not just epilepsy. You don't just say it's epilepsy, right? It's so important to know the causes of it, because it could be TSC.
You just don't know, right? And what was it I texted you the other day,
Epilepsy related to TSC, and it's not been diagnosed, right? Yeah. And then, of course, would impact on the treatment, isn't it?
I was going to say how I was relating to it the other day via text, and I was saying, well, I don't have tuberous sclerosis, but I did have what I called a bit of skank in my brain, which was from which the seizures were originating. So it's like I did have something in my brain, and I know it's not the same at all, but there are similarities. And I do think it's important for people, because my thing wasn't cancerous either, in the cognitive issues arising from that. So even though one only has temporal sclerosis, I wanted to point this out because I think it's a good, maybe a way for people with the more common temporal sclerosis, for instance, to relate, no matter what country they're from, especially actually, I guess, in low to middle income countries where the understanding or awareness of tuberous sclerosis complex is even lesser. Is that the term to use? I don't know. What do you think, Tolu?
It's thinking about it from a clinician's point of view. If you're a clinician in a lower middle income country, how would you know what to look out for? You could just easily just treat it as epilepsy and just diagnose, administer anti-seizure medication, but it's not gonna, there's still a lot more that needs to be done, isn't it, Ashley and Katie? Because I'm just thinking, you're gonna miss it. You're going to miss the treatment pathway, will not be right. The person's seizures will remain uncontrolled, and a whole lot of impacts, thinking about the psychiatric, impacts that we spoke about, the physical, cognitive impacts and all that from childhood. If clinicians do not know about it, they wouldn't know what to watch out for, and it would affect the patient journey, right?
Absolutely. I mean, I think that's the number one reason that we spread awareness, is that we understand that early identification of this disorder really helps, spearhead aggressive intervention and treatment options. And I think from my clinical experience, the families will say it is the epilepsy, but it's not. I can get to the point where I can accept that I have epilepsy, but it's the behavior, it's the it's the psychosocial concerns, the memory issues, the anxiety, the depression. It's all of these other factors that it's not one pill that can fix this. And from the clinician standpoint, it's you want to ensure that you're looking holistically at your family and the entire dynamic, and what can we do to provide better care and better outcomes. And aggressive therapy of seizures, that doesn't change because of the diagnosis, but we also know that it is imperative that we try to get seizure control as soon as possible.
So say you're in a low to middle income country, and stereotypically clinicians might not have access to an MRI.
Exactly.
And often not even an EEG, like literally. Right. How could somebody potentially correctly diagnose somebody with the tuberous sclerosis complex when they don't have access to these machines?
So that does make it difficult because, we don't have, X-ray vision and we can't see through, a body. But, it's really just understanding that, what are the guidelines that we currently have of international publication by our world experts, and how can we adapt that to your region locally, right? Like, what are those resources that you actually have? Maybe the best option is an ultrasound machine. And we can look at the organs that way. Is it ideal? It's not, but guess what? It's better than not knowing.
Nothing. Yeah.
Right. And so it's really just, finding that, that gap in care, but also understanding that, we have to work with the resources we have. And how can we adapt to your country with your resources? Because, we don't want the answer to be, you have to, leave your country, because that's just not a realistic expectation. So, finding those resources locally, adapting the guidelines to where individuals in their country that can get, care, that's what we're here for. That's why we have to start with the awareness aspect and understanding the guidelines. And then how can we adapt them to keep your community in your community and still provide the best care for this disease?
You're so right. Yes, we can go with the bit that we don't have all the resources. Yes, we would, if you could change it, right? So I work in the UK, I practice here in the UK. We've got access to all of these machines, and just as you do in the US. And this is why I'm so passionate about the EAMC, I put myself in the shoes of a nurse in a rural area in Sierra Leone, of a nurse in a rural area in Gambia, of a nurse in a rural area in Cameroon, or in Iraq, in Iran, and Afghanistan, and all those countries. And you're thinking, how will a nurse, how will a doctor, how will a neurologist in this area support people with these conditions? Because they are still there. There are people with TSC in Afghanistan, in Iraq, in Iran, in Cambodia, in all those countries. So we could go with the excuse that we don't have all of it, but then we need to work with what we have, and then empower our clinicians to be able to actually speak up to their governments, to people in power whenever they have the opportunity to say, we need an MRI. This is why we need it's so difficult to ask for funding for something if you don't know what you need that for. So it's actually, we've got 20 cases of TSC in this area. We need to be able to support that. We need this equipment, but we need to empower the clinicians through training to be able to do that. And that's why I'm so passionate. That's why I'm so happy that we're taking this topic on the EAMC.
Just to add to that, though, I think it's important, like when clinicians are hopefully, when they can, approaching sources of funding, that they are able to say it is 20 people who have tuberous sclerosis. Well, it's not only those 20 people who are affected by the disease.
Right.
It's so many more people, like with other diseases, other epilepsies. It's like ripple effect. So I really think it's important for these clinicians to be able to say that. 20 doesn't sound like that much, or whatever the number is. It's
no, I just blocked that.
I know. But by 5, 10, whatever it might be, a whole lot more people, because you will get many more. I imagine like mums and dads being, they're going to have better mental health. They're going to have better sleep. They're going to be able to work more efficiently, or work at all. Maybe they're not at the moment, or outside of the home.
I think that's a great point on, especially like the caregiver mentality of this. Caregiver burnout is so huge, and putting yourself in a it doesn't matter if you have all the resources in the world at your fingertips. If we don't provide the care for these caregivers to really give them the resources and the avenues to make life sustainable and achievable to whatever it is they're defining, their hope and their trajectory of their journey. That's incredibly, important. And when we see that here in the United States, and, I think about these, lower middle income countries where, it's not at their fingertips. It's not here. And the caregiver burnout is still there. That doesn't go away. And so it's like, how do we empower not only the clinicians, but the community and these families, right? I mean, that's essentially, the entire foundation of our organization is the community. And how can we invest in that and empower that, and regardless of your geographical location?
I'm just thinking of parents that have got children with TSC and don't even know that that's what their children have got.
Right. And I think, my child is just weird or something, or what are these funny growths on my child that I can see, or why are they having these seizures that might be down to spirits or whatever, which is pretty common in certain countries, right, Tolu? So to learn about the Tuberous Sclerosis Complex from you guys, I think it's going to be really empowering for them, just to see these commonalities with the descriptions you provide, and then have the neurologist go, okay, and they'll think of this patient that is affected in this way.
Yeah, I also want to ask another question. Ashley, when you were talking and I asked about the features, the common features of TSC, you mentioned about the skin. And thinking about someone with a darker skin, with dark color skin, will it be different? How will you know? What will you see? Because we have this conversation when we teach about epilepsy, and we talk about especially people going cyanosed and the difference. So when you go on training, they'll go, oh, you go all blue. And I'm like, no, that person with a black skin won't go all blue. The difference is, so you can't just say I'm not gonna go blue, really. So if that's what you're watching out for. Clinically, when we talk about different conditions that appear on the skin, we see a lot of pictures on pale white skin, but then it becomes difficult to know what it looks like on the darker skin. And these clinicians are in lower middle income countries where some of them have got different colored skin. What would it look like, really?
I think that's such a great question, because that's something we're actually working on of developing that, because the common question or the answer is it's still honestly the same. It's just the awareness of, okay, if it's African American, it's vitiligo, it's this, it's that. It's like there's all these differentials that are at the top of the list, but it's not as associated with, okay, this child is presenting with epilepsy and they have this skin finding. It's just probably a skin. It's just easy. It's quickly dismissed, specifically in the United States. And that is a huge initiative that we're doing, is that, the ED&I awareness of that it's not presented differently. It's just not associated with the disease. And so the pictures you see and things like that we have to, as an organization, represent the entire community, regardless of your race, so that, clinicians can be more aware of what it looks like and how to compare that. It's really hard to take a Caucasian and compare it to, if you are only, representing, another ethnicity, it doesn't come to your mind quick. So again, it all goes back to awareness and identifying with that same demographic and that, the same ethnicity and the same race.
Just thinking about from personal experience, my son he had a condition when he was in nursery. I can't remember what it was. And I saw it on the skin. I saw the rash on the skin, but I didn't know what it was. I just thought it was a normal rash. And I sent him to nursery the following day. And then I was at work. I received a text message from his teachers going, oh, we've got this outbreak in school. And I went to Google it and I thought, oh my goodness, that looks like what I saw on his skin. So I rang them going, I'm coming to pick him up. Took him to the doctor. The doctor said, no, that's not it. I said, so he went, the GP went on the screen whilst I was there in the consultation room, went on Google, he Googled it, and it was all white skin and stuff. And he said, oh, that's not what your son is going. I said, no, you're actually doing the wrong thing. Go back and look. And then he actually realized that was what he had.
That's so bad.
That was what he had. So that's why it's so important to look at it so it can be easily dismissed, like you said, because you just think it's just a rash, but it's knowing what to watch out for and how it may look. It's so important, especially in countries where they don't have imaging, where they don't have other, isn't it?
Do you know what? Similar thing happened with somebody I used to work with. She was very dark, and she went on holiday to Dubai, and she came back, and it was summer, so she had just thin straps on, and I was like, dude, you've got like these really dark freckly marks on your shoulders. Just watch those, because I partially grew up in Australia, so I'm very conscious of marks on my skin, especially because I'm so fair. And and she was like, oh, I hadn't even noticed. And so even for the individual, it can be really hard to pick these things out, I think, sometimes.
I've had a great time discussing this, but my last question for us really is, Ashley and Katie, is what are some of the topics the TSC speakers will be taking on the Epilepsy Assessment and Management course?
So we really want to have the speakers will be talking about what TSC is and what the surveillance and management for TSC is like, how to diagnose it. Certainly, we really want to be raising awareness. So wanting to give an overview of what TSC is and why care for TSC is so important, and how families and caregivers and individuals with TSC can all be supported as well. So certainly, we're really excited about this opportunity just to help bring some awareness to the disease. About 1 million people around the world have TSC, and our organization and the international organizations are in contact with, so few of them, and relatively speaking, for the number of people that are affected. So I think that really just doing what we can to raise awareness and hopefully everybody will be able to take something helpful away when they go back to when they're taking care of their patients, or perhaps this will, allow for some new diagnoses to happen based on what people have learned in this course.
1 million people, and those are those we know.
Mm-hmm.
What about those that do not even have the diagnosis and do not know that this is the condition? It's a bit worrying, but we can do something about it in our own way. And I'm so happy we've partnered with TSC Alliance to achieve this. Right now, we have participants from over 30 countries on it. Afghanistan, Iraq, Iran, loads of countries in Africa. We have from Grenada, we have from St. Lucia, and really, they're going to learn about, TSC. Some of them would already know about it, and they will learn some more and acquire new knowledge. And what some would not know will be the first time that they will hear about it or learn about it in a learning space. So it's a great learning opportunity, and thank you for bringing that on to our training. Really, Torie, do you have anything you want to say?
Oh, nothing that's not cheesy. No, I just think that this is like really lovely, and I think it's going to be very empowering for the clinicians, and as I've said a million times on different, in videos, but the more you learn, the more you realize you don't know. And I think, I know that tuberous sclerosis comes under that as well. And I'd be interested to learn actually over time, now that we're able to reach out to the low to middle income countries a bit more, to find out statistically, may certain tribes in certain countries have higher rates, lower rates than in other areas? Could there be another gene that plays a part in this? Maybe that's another topic for you guys. But yeah, it's just really, really interesting. So I think rather than people being scared of this disease or this epilepsy and everything, just think that this is really quite exciting.
Just there's a comment, someone wrote a comment on Facebook saying his name is Zaman, and he said, I'll be attending this training all the way from Pakistan.
Oh,
fabulous.
That's wonderful. That's really helpful to think about where people will be attending from, because people from all over the world will message us and ask for help or information and resources in their countries. And having somebody in Pakistan will be knowledgeable about TSC will be wonderful for when we get questions from families and we can say, oh, there's this expert here now, there's a doctor here is familiar with TSC. So I think that's a very exciting aspect. I'm very glad he'll be participating.
Ashley, do you have any last comments?
No, I'm just very excited that we're partnering with you guys. We love what you guys are doing for all of epilepsy, and especially allowing us the opportunity to share more awareness on this specific type of epilepsy. We're very grateful for that, and our families are very grateful for that as well.
Please say hi to them all from our little islands of the UK.
Yeah. Casey, any last words?
I just want to thank you guys both for this opportunity. I think we're very excited, as Ashley said, about this partnership. And I think we have so much to do to raise TSC awareness, and you can't do it all by yourself. So this is, I think, really a very unique and special opportunity for the TSC Alliance to be involved in terms of raising global TSC awareness. So thank you.
Thank you, everyone, for joining in. I do want to say a big thank you to TS Alliance for partnering with Pretola on this project. It means a lot to us. It means a lot to me as a clinician. And also, I want to say a big thank you to Rowe Foundation, our second partner. Without both organizations, it will be difficult to make this training available to our clinicians because it's free. Clinicians can register, on the training free down to, and this is due to the support we've got from both organizations. Thank you very much. And I'm really excited about the learning opportunity and what the clinicians are going to take back from just the whole day session they're going to have on TSC. It's an important topic and it's new. It will be new to some of them, and it's going to generate interest, learning. They want to dig some more about it and obviously start to, develop that community in support the community rights as well in their countries. Thank you all for those who have joined, watched this wherever you're at, and those that will watch it afterwards as well. Thank you all. Send us any questions you may have to our email on info@pretolaghc.net. And you can also connect with TSC Alliance. They're on Facebook, they're on Twitter, they're on Instagram, they're everywhere. You can connect with them as well. And for those that want to register on the EAMC, thinking, how do I get on this EAMC? Just go on our website. It's pretola.net, pretola.net/book EAMC, or you could just send us an email on info@pretolaghc.net. Thank you all, and do have a wonderful evening, afternoon, or day.
Wherever you are.